All right, this tutorial is the anatomy of the facial muscles, so you can see your targets. Once you see this, it will really make sense to you where you inject neurotoxin and why. All right, here are the facial muscles. And you can see, so first is for our frown complex. So for the glabellar lines, we have two main muscle group targets. We have our procerus muscle, which is this more vertical muscle here that inserts right at the nasal root. And then we have our corrugator muscles, which are these little muscles right under here. They almost look horizontal. They're tucked in. They run into the procerus muscle, and they're tucked in behind the orbicularis muscle around the eye. Then you've got these are your brow depressor muscles. So the net result of these muscles is they pull the brow down. So when you frown, you're frustrated, you're angry, and you're concentrating, these are the muscles that you engage to pull your eyebrow down. Your frontalis muscle is this muscle, and it's interesting, the muscle fibers run this way, up and down. So you can see that when this muscle contracts, what it's gonna do is it's gonna lift your forehead up. So these are your brow elevator muscles. That's why the fibers run this way. The reason why the lines on our forehead are horizontal, they're not wrinkles, they are lines of facial expression. And so when the skin bunches up, so as this muscle lifts and contracts, over time, you start to get grooves that run horizontally through the muscle where that muscle is contracting. And as we age and the skin gets loose, the skin sits in those grooves. So all of this neurotoxin, it doesn't actually do anything to skin. What it does is it binds irreversibly on the motor end plate of the muscle, and it prevents the electrical signal from going across the synapse, and it puts the muscle to sleep. So even when your brain creates the electronic signal for the muscle to contract, the signal doesn't get to the muscle and the muscle stays flaccid. We had originally hoped that when we did these neurotoxins that would be a permanent change because the product binds irreversibly on the neuromuscular end plate, but it turns out the body is smarter than us and it regenerates new end plates and it outsmarts us. And that's why after several months, your neurotoxin wears off regardless of which one you're doing. So again, you've got your frontalis muscle, which is your brow elevator muscle, your corrugators and procerus, which are your brow depressors. In the upper lip, you've got orbicularis, all right? And when this upper part of the muscle contracts, it lifts your lip up and allows you to pucker and kiss. Now we also do Botox or neurotoxin, into these depressors here. And these angular depressor muscles, which originate and insert right at the angle of the jaw. What this muscle does is it pulls the corners of your mouth down when you open your mouth. So as we age, and again, the skin gets a little bit loose, the pull of this downward muscle starts making the corners of your mouth turn down. So one really nice thing you can do, which is very small amounts of neurotoxin, is by putting a little bit in at the lower end of this muscle at its insertion point, you can weaken the downward pull of the muscle without weakening the upward pull of the muscle, and you can allow the corner of the mouth to just kind of float up. So where the corner of the mouth starts to turn down, now you can let the corner of the mouth float up. You can weaken the upper lip just ever so slightly and allow the upper lip to roll and float upward. We call that the neurotoxin lip flip. So if you've got somebody who's got a pretty nice upper lip, but they want a little bit of a fuller upper lip without pumping it full of product, like one of the filler products, a small amount of toxin in here will allow that to float upward. It's also nice for smokers' lines. Then you've got your muscles of mastication. You've got your masseter muscle, which is a big, thick muscle over here on the side. I don't know if this shows it. It doesn't show it better. And you can put Botox in or neurotoxin in over here, which softens this, and it allows this sort of outward bump to soften and flatten. It's great for people who grind their teeth. It's great for people who have TMJ, so you can use it therapeutically for that. And cosmetically, it softens this and it creates a little bit more of an angle and a tapered jaw. So people who have a really well-developed masseter muscle and have sort of like a full puffy cheek here, you can soften that angle, which is very feminine for women. So we've got forehead, brow elevators, brow depressors. We've got at the edge outside the orbicularis in the temporalis region, we've got the crow's feet. We've got the upper lip for smoker's lines and pucker lines and for more show of the upper lip. We've got masseter muscles for TMJ, for teeth grinding, and for angling the jaw. And then we've got injection points even with the corner of the mouth at the angle of the jaw into the bottom of this muscle to allow the corners of the mouth to float up. You can use neurotoxin in the chin for wrinkling and crinkling. That's these muscles in here. You can also do it for platysmal banding. That's sort of more advanced neurotoxin. We're gonna stay concentrated on the face just because we have so much to go over. We have little lines here at the root of the nose that we call the bunny lines because they're kind of like where a rabbit scrunches up its nose, and you can see where your procerus muscle inserts in. You can put a little extra product right in there, and what it does is it softens and it redrapes and it gets rid of the little crinkle lines right at the base of the nose, so people really like that. This is also a really nice way to show the danger zones for where you can get side effects from neurotoxin. So your major issues with neurotoxin are going to be when you're doing the forehead is you can give somebody a droopy eyelid. It's not permanent, it does wear off, but their eyelid can be droopy for 3 months. It's really annoying. And then you have to use eye drops, which can elevate the lid back up, but they also dilate the pupil. And so that, of course, you have trouble reading and sitting at the computer. And certainly if you're a surgeon and doing sort of fine stuff, you're not gonna be able to walk around with a dilated pupil. So this is really a side effect that you want to avoid. The reason why people get a droopy eyelid from neurotoxin is that product diffuses when they're trying to do the frown complex. Instead of the product staying in the procerus and the corrugator muscles, product diffuses and gets into the top of the orbicularis, which makes the top half of the muscle weak, which lets the lid drop and get droopy. So I will show you when we do the actual video on injections, little tricks you can do to make sure that you stay out of the danger zone and you don't put product into the orbicularis muscle. The other side effect around the eye that's been described is a dry eye. The lacrimal sac, which is where your tears are made, is in your upper eyelid. So tears are made in lacrimal sac. They drip down into the eye from the upper eyelid. They drip across the eye, and then they exit from the punctum of the tear duct and they drain into your sinuses. So they drain across the eye with gravity. And so you're not gonna be anywhere near the lacrimal sac with your Botox needles or your neurotoxin needles. They're really tiny needles and you're injecting out and around. As long as you stay outside of the orbicularis muscle, you're not gonna have product that diffuses in and gets to lacrimal sac. So the general rule of thumb is, and I'll show you this in the injection videos, is you're always gonna palpate the orbital rim and you're gonna stay 1 centimeter outside the orbital rim in any injection point. So if I draw on this, you're gonna basically find the orbital rim, you're gonna measure 1 centimeter out, and then all of your injection points are gonna be out here, outside of 1 centimeter. Same thing up here, you're gonna palpate for the orbital rim, and then you're gonna measure from the orbital rim up 1 centimeter, and your injection points are gonna be in these muscle groups up here. It's easier to see on this side because the muscle's shown a little better than on this side, but you're gonna be 1 centimeter outside your orbital rim, and you're gonna be injecting 2 injection points, 1 into each muscle group. So 1 centimeter is the number to remember. If you stay 1 centimeter outside the orbital rim all the way around, you won't have any of those side effects. The other place you can have side effects from neurotoxin is if you're doing crow's feet. So again, you're 1 centimeter outside and you're coming down over here. If you are doing anything in lower eyelid and you come too low and you come over the malar cheek and you end up hitting this muscle group in here, you get weakness of the cheek and you can have some droop to the upper lip. So general rule of thumb is stay 1 centimeter outside the orbital rim and always stay above the zygomatic arch on the cheek. And then you really won't have any trouble with neurotoxin side effects. I'll show you some technique related to injection when we do that video that will help you prevent any of those side effects. Side effects around the mouth simply have to do with too much product being put in. We use very, very small amounts of product in the upper lip and for the angles of the jaw, just so that the mouth doesn't get too weak. Major complaints with neurotoxin around the mouth are that people come in and they say, I feel like I can't smile great. I can't say words that start with the letter F. I can't drink through a straw just because their pucker is kind of weakened. And so I'll talk to people about that before we do that for the first time. It's not that they don't like the cosmetic outcome. They typically love what their mouth looks like, but they don't like the way it feels. And so there's things you can talk about with people to minimize that for them and sort of prepare them for that. Okay, so that's our basic anatomy lesson. And then we'll move on to the next video.